The news that President Trump had tested positive for COVID-19 broke early last Friday morning. So, Mike, what was your initial reaction to that news? And in the days since, as more in the White House have tested positive, what have you been thinking about? What are the lessons we can take away from this outbreak?
Well, first of all, let's take a step back. I'm not going to comment specifically on the actions of any one person in the administration. That's what people would expect to have happen, and then immediately we devolve into a partisan discussion. But let me take a step back and say, if you were on this podcast as early as July, you heard me say that I thought that the testing program put in place at the White House to protect the president and the other senior leadership was not a plan at all. And in fact, it reminded me of providing all the Secret Service agents with squirt guns and expecting them to protect the president against an assassin. Let me just say a couple of comments about testing and what was done at the White House. This is one of those examples where there was a mindset you could test your way into safety, i.e. test your way out of the pandemic. Simply not possible to do. Testing is always going to be after the fact. It's going to be a situation that even if it is highly reliable, it doesn't protect you from being exposed. All it does is tell you that you were. And now some people would say, but if I know that I'm infected, then I can take steps to reduce my risk of transmitting to others. And that's, a great idea. But let's just be honest here. First of all, the tests we're talking about, these point-of-care tests are often coming up with more than 30 to 50% false negatives, meaning you're missing people who are positive. And so if you're trying to bubble yourself, that's one thing. The second thing, though, is I would acknowledge to those who promote this new testing approach, a strategy for containment, as they call it, this will help. But with one caveat. As we just saw what happened at the White House, will people actually use this information to actually change their behavior so that they don't transmit? And we saw a number of examples of people who were contacts of cases, who actually didn't abide by what we would hope would have been risk reduction behavior. So I'm not suggesting that's widespread in the population, but when you have almost a third of the public that doesn't even believe this pandemic is real, you have a number of people who are experiencing pandemic fatigue who just think it's too much, I don't want to deal with it. And you have a number of people who are bubbled in today because of their high risk of serious disease if they get infected. That doesn't leave a lot of people left in the middle necessarily who are going to be impacted by this kind of testing. And so the last piece is that also with this point of care testing, we're going to show very shortly that there is actually a very important number of false positives. And wait until people are taking these rapid tests and come out false positives only to be confirmed by PCR that they weren't positive at all, and see how long that's going to last. And watch that spread around as a challenge. Why not to take them? Because the next thing you know, you got to get worked up. You got everybody upset and concerned. And it wasn't even a true positive. So I just want to come back to this issue. I would support any kind of testing that might help actually reduce the number of cases. And I think the White House experience really is that. It shows you the challenges of using testing in a regards to behavior change and what it means or what it does. So yes, it can have some impact, but it's not going to have this major containment strategy outcome. And I'm sorry that the White House situation ever occurred, but I think it's illustrative of the point that we're making. And again, false positives and false negative point-of-care tests are occurring much, much more frequently than people realize, and they will dramatically impact, even among that limited number of people who are willing to consider taking these on a routine basis, what they ultimately will do. Now, what I have a hard time with is that no one addressed that situation at the White House, even though it was raised with them on numerous occasions that this was a terribly inadequate plan. Keeping in mind that this is what I have been basically saying, as many of you know, it is emblematic of we don't have a national plan for responding to this pandemic. So why should we be surprised if we don't have a White House protection plan? And so what this episode really should tell us is we still have a desperate need for a national plan of how to respond and how we bring the 50 states together, recognizing their diverse differences, whether they be urban or rural, or whether they be west, south, north, east, wherever. But we need a comprehensive plan. We don't have that. People will say we do, but I defy anyone to actually come forward and tell you what our plan is. But this is where I also have some hope, because there is one location that has a plan, New York. Now, I know several of you have written in to me about Vermont. Vermont, too, has done very well, although the last 2 weeks they've been seeing an increase. But let me just go back to the concerted effort of New York. I've talked about this before. I want to acknowledge those who painfully went through the last March, April time period and lost loved ones in long-term care facilities. That was a challenge. That was a real problem. That was not what we wanted or needed. But since that time, they've done a remarkable job. And we went for better part of almost 14 weeks with this very low level of activity, days without deaths. Now, what was an interesting development, however, in the last 3 weeks, they've seen an increase in New York City, particularly in Orthodox Jewish communities. And there has been this back and forth between the governor and the mayor about how to respond. But the point of it is they've identified the increase. They know where it's occurring. They have an idea of what community it's occurring in, and they're taking steps right now to try to limit that transmission and drive it back down. That gives me hope. That's a plan. That is a plan. I have been asked to review these New York plans on a daily basis in terms of numbers and so forth, and they, unlike any other place in the United States, adhere to the everyday data to try to drive this down. So I want to just say that as much as what happened at the White House was a debacle, there is an opportunity out here to learn from those that are doing it right. And New York is a good example of that. So I want to make that a point. The second thing is, I don't really know how to talk about this because I want to be I don't want to be misunderstood because I'm not wading into the politics of this. But how much longer do we have to go as a group wondering what it is we need to do to respond to what the administration does or doesn't do? We lose so much sleep, we use so much energy, and we know the situation is what it is. I think we need to move on. I'm kind of over the idea of public health theater, of the idea that, how are we going to respond to this, respond to that? What we need to do is take the bull by the horns and say, okay, are we as citizens in our own states, our local areas, trying to get our national leaders to do that we need to make happen to accomplish the kinds of risk reduction activities? Where do we go with that? And so I'm not going to spend any more of my time in public health theater. I think it's a waste of time. I know who those individuals are that can contribute to improving our public health response. I know what we need to do to help support various federal, state, and local agencies in trying to get that done. So I think at this point, what we should do is concentrate on kind of a coalition of the willing. Who we have together that come together to bring us the national plans, the national approaches that really are based on the best science and support that kind of activity. I'm not going to spend the time getting into, he said, she said. I wish anyone who had COVID-19 infection the best. I continue to offer my sympathy to those families who have lost loved ones to this disease, friends, colleagues, whatever. And so from that perspective, let's just move on. Let's just take this situation and say, we're not going to change it. We're not going to change that national perspective of some, but we have a coalition of the willing that can really make a difference. And over the course of the next several podcasts, I plan on trying to cover those things I think that we can do now, that we don't have to wait for someone else to help us do them, and that we don't have to be discouraged or prevented from doing them by the rhetoric of a few.